Dr. Goes from Belgium. He will talk about bilateral TECNIS multifocal versus customized TECNIS multifocal and ReZoom, achieving spectacle independence. Dr. Goes.
Thank you. So let's discuss the best way. How can we achieve spectacle independence by using a TECNIS lens, by using a ReZoom lens, or by combining both of them? A short overview of the TECNIS lens. As you know, it is a diffractive lens. The refractive part is on the back of the lens. It comes as a silicone. It will come as the new lens will come also as an acrylic. Anterior prolet surface enhances the contrast sensitivity, and the effect is pupil independent, very important. Let's go over some data. This is a 2 years follow-up now of hyperobes who came in for a refractive surgery. They got a TECNIS multifocal lens in both eyes, one session. They were no candidates, of course, for LASIK. Very high hyperope, still +9. Now let's look at the outcomes when we use the TECNIS in both eyes. Here you see the results in red uncorrected and in green distance corrected. These are monocular results. And as you can see, 100% of these patients could read Jaeger 2 or better without correction. So excellent outcomes for the TECNIS lens for reading. Now let's look at their distance outcomes, and again uncorrected in red and best corrected in green. Of course, pre and post, pre-uncorrected and post-uncorrected, tremendous differences is as we could expect. But even post-corrected compared to pre-corrected, we had better outcomes, probably by changing the astigmatism by operating on the steep meridian. And as we could see, 95% of patients were always free from glasses. Only 4 needed glasses for PC work. How often were they without glasses? That's why they came. 49 out of the 52 were without glasses all the time. We have to mention that we had to enhance 20 of these eyes with a LASIK or LASIK. Is there such a thing as a free lens? It does not exist. All these multifocal lenses have some disadvantages. The majority of the cases, they will disappear, they will be minor, but in about 5%, they will have major disadvantages, halos and glare, driving at night. They can drive, but some of them don't like to do it anymore. So the TECNIS, the strong points, excellent distance vision, excellent near vision, good distance vision. The weak points, sometimes intermediate vision is not good enough. Now let's look at the second lens. It's the ReZoom lens. It's a refractive lens, 5 different zones. It's a multi-zone refractive lens. It has a near addition of 3.5 compared to the TECNIS, who has an addition of 4 diopters. So the reading will not be that close. It's a much improved array lens. The strong points of this lens, very good distance, good intermediate, and the weak points, spectacles sometimes needed for small prints. Now let's look at the matrix. How can we help these patients out by customizing or combining these lenses? A patient with the intermediate and far vision dominance, of course, he will be a candidate for a ReZoom lens. A patient with near vision dominance, a reader, a librarian, he will be a candidate for a TECNIS lens in both eyes. And an all-rounder, he will be an excellent candidate for a mix and a match. So some examples. Professional car driver at night, he will probably get in the majority of the cases a TECNIS monofocal. We are afraid of inducing some halos and glare. A bookworm, he will be an excellent candidate for a TECNIS multifocal. And a nature lover, a golfer, like Gary Player, he will be a good candidate for a ReZoom lens. A wish for less spectacle independence, generally speaking, he will be an excellent candidate for a mix and a match. Has it been done before? Of course it has been done. Here are some comparative studies by the Brazilians. They've done thousands of multifocal lenses. And I highlighted in green where the outcomes of TECNIS ReZoom were better than Restore ReZoom, bilateral Restore. And as you can see, in their results, nearly for all factors, TECNIS ReZoom performed better than other combinations. Lopez Castro, another interesting review at 1 year, and again in green where the combination was better than the bilateral ReZoom, nearly for all factors again, near mesopic, intermediate mesopic, hair and glare, and never glasses. The combination was better. Now how do we do it? How do we custom match the eye? First we determine the dominant eye. Exact biometry is extremely important. We do first surgery in the dominant eye, and then we have to wait 1 or 2 weeks. We look at our patients, we talk to him, and then we decide which lens for the second eye. If the major activities are distance, as said, it's a ReZoom. If it's near, it will be a TECNIS. Now let's go over our data. It's 38 patients with this customized approach. It's 6 months follow-up now. All of them are spectacle-free, and their satisfaction degree is very high. Important subjective complaints, yes, they're still there. About 2 of them, they have a lot of complaints. It's exactly the same. And minor complaints improved over time. Now we looked at their monocular distance correction acuity, and we could see we have here the TECNIS in red and the ReZoom in green. Much, much better with the TECNIS than with the ReZoom. Let's go at the outcomes for the reading distance. We see that the reading distances are different. It's mentioning 4 minutes and 36 seconds. I suppose I can go. I can continue. We measured the reading distances. What's the ideal reading distance for a TECNIS and for a ReZoom? And you see the differences here. For the TECNIS, they had to read closer compared to the ReZoom. It's 2 centimeters, but it's important. We looked also at their distance at acuity, their gain in acuity of 1 line or 2 lines. And here we could see that the ReZoom, they had more gains than the TECNIS lens. Intermediate at 60 centimeters, extremely important. We know that these lenses give excellent vision for distance, for near. But how for the intermediate? How for the PC work and so? And again, here we could demonstrate the differences. The ReZoom in green and the TECNIS in red. Here you see Jaeger 1 to Jaeger 3. About 40% of the ReZoom could read it. This is monocular. And here only 10% of the TECNIS. And when we looked at the Jaeger 3 till Jaeger 5, about 80% of the ReZoom eyes could read it, and only 40% of the TECNIS eyes. So here what we could measure what we expected and what the lens was supposed to do. Halos on a scale of 0 to 3, not much differences, maybe some minor difference, maybe a little bit more halos with the ReZoom, but this was statistically not significant. So when we look at the outcomes and the results of this series of 38 patients, where we put a TECNIS in one eye and a ReZoom in the other eye, 2 out of them had important subjective complaints. The minor complaints improved in the majority of cases between 1 and 6 months. And of course, never explant a multifocal lens before waiting 6 or 12 months, because even then it can still improve. No statistical significant differences between both lenses qua halos and glare, maybe a little bit more with the ReZoom. So why should we customize? We should customize in order to obtain excellent vision at all distances, far, intermediate, and near, and in order to eliminate the complaints of glare and halos. And thank you for your attention.
Thank you, Dr. Goos. Now, there is another tool for correcting presbyopia, Dr. Dishler from the United States, clinical evaluation of corneal inlays to correct presbyopia.
Good afternoon, I'm Dr. Barragan. Dr. Dishler can make it. I have interest financing in this project. The Presby lens is a corneal inlay. That's a new material engineered for optimal biocompatibility. Has the same index of refraction of the cornea, and it's an additive procedure that tells the anterior corneal curvature. It's implanted under the flap or in a pocket. It's compatible with LASIK and is exchangeable. This is the ideal profile that in the near, number 1, 2 intermediate, and 3 distance in a 5mm pupil. So we can see in the other chart that is a 5mm and a pentacam difference map. So you can show the 1.5 power in the center and goes down onto the periphery of the cornea. The Presby lens is a clear lens. It's very hard to visualize on the slit lamp. You have to use some retroillumination so you can see the lens. On the OCT Visante, still clear after 9 months post-op in vivo. The pupil constriction provides a pseudo accommodation. This is a Tracy analyze that goes on the annular refraction and the zonular refraction. So you can see at the 5mm pupil, you are closer to plano, and it goes down the pupil millimeters up to 2.5. You can have a 1.5, 1.75